MARTA's recent decision to move several life-saving defibrillators out of public reach has sparked fresh debate about balancing security with urgent medical access, as sudden cardiac arrest survival depends on every second, every minute, folks. Some folks want to know if the trade-off makes sense for public health. With us right now is Dr. Marcus Brown. He's a cardiologist, and he is the past board president for the American Heart Association of Metro Atlanta. Dr. Brown, welcome to the show.
Good morning, Chelsea. Thank you for having me.
Hey, man, good to have you on here. Let's start off with this, how critical time is when someone's having a heart attack and you got to get to a defibrillator.
Yeah, it's very critical, Chelsea. You know, cardiac arrest, I should say out of hospital cardiac arrest actually occurs in 350,000 people a year. And every minute is actually critical. Only about 10% of people actually survive cardiac arrest. And for every minute you're without CPR or without a defibrillator, your chances of survival drop 10%. So having a defibrillator accessible quickly is very critical.
So what's your take on having it behind a glass case or whatever, where police have to remove it first if somebody's having a heart attack? What's your take on that?
Well, it's definitely not standard practice, and I don't think it's a good idea. I think that, we have to come up with other ideas to try to figure out how we can actually keep the defibrillators in a place that's safe. From reading the article, I think MARTA is doing it because of the theft of the actual defibrillators. So I think it just, rather than locking them up and, requiring an officer to come and unlock it, we need to come up with some other sensible ideas, maybe putting an alarm on it. So when people open it up, or putting it in a really, really high traffic area to try to decrease the chances of it getting stolen. But I don't think it's a good idea to actually have it locked up because, again, that could take several minutes to actually get an officer to come and unlock it and get the AED. And again, every minute matters.
Yeah, and so MARTA had made a statement on this, is saying that it makes more sense that they be housed in a staffing office or readily available than missing entirely due to theft. Is this something new? Have you heard of this? Why would people, would they take defibrillators? Why would they steal them?
I have no idea. This is my first time hearing it. I couldn't imagine somebody stealing it and going to a pawn shop and actually saying I have an AED here. They are, they do have value. The cost of an AED is about $1,800 to $2,000.
Wow.
I'm not sure, when people steal them, exactly what they're doing with them. So this is the first time that I've actually heard of it.
Yeah, it seems strange that people would take those, maybe one in their house or something like that. What advice would you give leadership at MARTA to combat this and to help out what we would need crucially if somebody had a heart attack?
Yeah, I think first of all, discussing it with, a body like the American Heart Association, creating a roundtable so we can actually have meetings, educate MARTA on how critical it is to have AEDs accessible, and then try to come up with some other viable solutions. Like I said, putting a camera there, putting an alarm on it, putting the AED in a high traffic area to try to decrease and discourage theft. But I think just simply saying we're going to remove them, I don't think is good for the public.
All right, Dr. Brown, we get into a situation where somebody's having a heart attack, there's no AED there, what should we do?
So the first thing you should do is call 911. And if you have someone who is in cardiac arrest, who's not breathing, doesn't have a pulse, start CPR. This is something that the American Heart Association actually pushes. It's easy to learn CPR. You can go to the American Heart Association website to learn, but definitely if someone is collapsed and not breathing, doesn't have a pulse, you should start CPR. And if there's an AED available, you want to ask for the AED. Again, CPR and using the AED can double or even triple somebody's chances of survival from a cardiac arrest.
So do you think a death could lead MARTA to change their policy on this, sadly?
Well, from what I was reading, I think that MARTA should be aware of how important AEDs are, because I think that a couple of MARTA police, a few years ago actually saved a couple of people's lives using the AEDs that are there. So they should know, that there's value there because lives have been saved by them.
Yeah. Yeah, so we'll see. We'll probably have you back on the show, I'm sure, especially if an incident takes place. Really appreciate you joining us for today, Dr. Brown. Have a
Absolutely.
good one.
Glad to be here.
All right, take care. Have a good one.
Take care. You too.